Dr. Napolitano, let's talk about eyeglasses and or actually lenses. Some people, and I would be one of them, I'm wearing 99 cents glasses for reading. And you tell me whether that's a bad thing and I should really do something else, something more sophisticated. But the point is, I see my wife putting in lenses, and me, I can't take eye drops because I just don't like it. I probably need to get used to it. Anyway, tell us a little bit the difference between eyeglasses and lenses. Besides the fact that some people might prefer another one, is there any difference in quality, any disadvantage from one versus the other one? Talk a little bit about that, please.
Well, contact lenses are not for everybody. Just like you said, you have to be able to touch your eyes, to put these lenses in your eyes and take them out. So they definitely are not an option for everybody, all of our patients. But if it does work and if you are able to use them, then it's a wonderful alternative that we have available. Let's say you have a wedding to go to and you don't want to wear your glasses. Now you can put your contact lenses in. So that's a nice option that we have. Nowadays, we have a lot more option when it comes to contact lenses. We have contact lenses that correct for the astigmatism. We have contact lenses that also correct for presbyopia. The market is definitely expanding. The optics are becoming much better than what they used to be.
To interrupt you, explain stigmatism, explain presbyopia. Which one of those? What are we talking about here? Nearsighted, farsighted, reading? What are we talking about?
Okay. All right, let's talk a little bit about that. So nearsighted, when a person is nearsighted, basically they're myopic, what we call myopia. They are not able to focus at distance. They can't see far away, but they're able to see up close. If a person instead is farsighted, what we call hyperopia, then it's the reverse. The patient is not able to focus at near. They cannot see up close, but they're able to see everything far away. Now, these are very broad terminologies there, very broad definition. If a patient has higher amounts of either or, then the vision is affected at both distances, both far away and up close. Now, astigmatism, on the other hand, is just the shape of the eye. Pretty much the cornea, which is the front part of the eye, instead of being perfectly round, one side is a little bit longer than the other. So it looks more like a football versus a basketball, for example. And that also affects vision at both. It affects at distance and at near. Okay? Because it causes distortion. When the light hits the eye, it causes some distortion there. And a person who's nearsighted or farsighted could also have astigmatism at the same time.
Got it. And is a nearsightedness when you don't see close up? Is that the same than needing reading glasses, or is that still a different phenomenon?
Now, needing reading glasses after the age of 40, that's called presbyopia. That happens, and everybody's going to go through this process. It's not one person that happens, one person doesn't happen. Everybody's going to go through this process. After the age of 40, again, is another thing to look forward to. But unfortunately, our eyes, they lose the ability to focus up close as well as they used to before. And hence, you're going to need reading glasses. Now, if you are a person who is nearsighted to begin with, where you really have a hard time seeing far away, but you can see up close, even after the age of 40, if you take your glasses off or your contact lenses off, then you might be able to see up close. But when your distance vision is neutralized, when you have glasses there or contact lenses, you're not going to be able to see up close. And everybody's going to go through that process. No matter whether you're farsighted.
Let's go back to the glasses a little bit here for a moment. So, glasses versus contact lenses. What do you think are the pros and cons in either one of them?
Well, contact lenses, let's talk about contact lenses first. As I was saying before, it's a wonderful option that we have available to us. I'm wearing contact lenses myself right now. The mistake a lot of people do, that I see in my practice is overuse of contact lenses. Contact lenses, they're very safe, they allow clear vision, but it's still something that goes in your eye, that it should not be there. Therefore, it should not be used for 7 days a week. It should not be used when we go to sleep at night. And it should not be used from the moment we wake up to the moment we go to sleep. There should be a time where your eyes during the day are without any contact lenses in, so that the eye can breathe on its own and can relax. And what I usually tell my patient is just wear them a maximum of 6 days a week, and at least once a week stay out of contact lenses. Just let your eye rest, let it breathe on its own, and definitely don't sleep with contact lenses. I would say, in my opinion, sleeping with contact lenses is the worst thing you can do for your eye, because you're really decreasing the amount of oxygen that goes to the eye. Glasses, on the other hand...
Even, let me ask you a question here, because there obviously are contact lenses out there which you now can wear for 6, 7, and even more days. They're apparently made for that. So are you telling me that you're against those particular contact lenses?
I am not against them, but I prefer not to use them. Removing the contact lens, in my opinion, only takes a few seconds. And at night, if taking a few seconds to remove the contact lens so that your eye can be healthier is too much time, then that's not a good thing. Then maybe you should not be wearing contact lenses. Now, there are instances where I do use those overnight contact lenses for my patients, because using those let's put it this way, if I know that my patient is going to sleep with contact lenses no matter what I tell them, then I'd rather them having a contact lens that is approved for overnight use, so that I know that at least they're getting more oxygen, but I do not recommend it.
Got it. All right. Glasses.
Glasses, there's really no cons of wearing glasses. In some instances, if you have a high prescription, then glasses could reduce the amount of peripheral vision that you see because of the thickness of the lens. In that case, I do recommend contact lenses more. The other instances where eyeglasses might not work for a specific person is if they have different prescription between the two eyes. If the prescription difference between the two eyes is great, like for example, one eye is nearsighted, one eye is farsighted, then glasses are not going to work, because there's going to be too much image difference between the two eyes with glasses, and therefore even in that case, contact lens is going to work better.
Got it. What about the people who need, I guess, what's called a bifocal, nearsighted and farsightedness? On an average, I mean, let's forget about the patient's preference in terms of looks, because, glasses become very good. They're a fashion statement, so there's nothing, it's not like in the old days where our parents or grandparents where, a glass was definitely a bad thing. They look good these days. So, let's forget about that aspect, but would a lens be, contact lens be better for those people who need to be switching around between a far and nearsighted, or a glass better, or doesn't make a difference?
Sometimes, eyeglasses are definitely going to work better in that case, because we can definitely control the eyeglasses a lot better. Contact lenses, we do have contact lenses that also correct for what we talked before, the presbyopia, when the person needs maybe glasses for far away, and now they're over 40, and they also need glasses for up close. So those are called the multifocal contact lenses. We do have we have them available. We do use it. I do a lot of multifocal contact lenses in my office. They don't work for everybody, but I would say on 75% of my patients, we have a great success with those lenses. My patient is able to see far away, up close, computer, everything, and they're very happy. And sometimes they just don't work. Sometimes because due to the optics of the lens, to some of my patients, that lens just does not work. So in that case, the only option that we have at that point is to use eyeglasses.
Got it. Well, all right. That's lots of information about glasses and contact lenses. I mean, it looks like the problem can be solved in a few different ways, and it looks like that depends on the patient's preference or the patient's ability, such as, like me having probably a hard time putting in lenses since I don't even want to keep the eyes open when I shower or go into the swimming pool. So either way, most problems can be solved both ways, even though here and there seems to be a little bit of a handicap in one or another one, but either way it can be solved. And some people can use contact lenses, sometimes glasses, most of the times, things like that depends on their particular wishes and situation. Sounds great. Thank you very much.